Hello, my name is Kath and I'm Head of Patient Experience with a remit for children, young people and families at NHS England. I want to ensure healthcare is as safe as it possibly can be for the children, young people and families that we serve. I think sometimes we miss a trick by not involving families as much as they possibly could be and ensuring that they're really true partners in the care of their child. It's an issue we need to be honest about and have a conversation about too. I've been chatting with mums and with dads and also other healthcare professionals about this. People have shared their ideas and I'd like to share some with you today. I'd like to introduce you to Leslie. Leslie is mum of Amelie. She thanks healthcare professionals who listened to her concerns. They took her seriously and they also took action. Here's an extract from her blog. Thank you so much to the nurse who listened and took me seriously. Even though Amelie appeared well and was playful, thank you to the doctor who in the end did agree to repeat bloods and wasn't dismissive of the fact I presented to him. It's not that we want to say, I told you so, or be pedantic. It's simply that parents notice the very subtle things that may not be so obvious in the grand scheme of things on very busy wards, especially when caring for our own child 24/7. I appreciate doctors and nurses have so many medical histories and obs to think about and only want the best decisions and outcomes for their patients. However, parents only focus on their own child's well-being, and often complex needs families understand the uniqueness and individuality of their child. And this is a message reinforced by other parents. So here are some messages we've collected on Twitter. Paul shares, we know our children, their skills, their anxieties, their fears, and also how to overcome them. We need to work in partnership. Leslie talks about her innate intuition as a mother. She may not be able to diagnose, but she knows in her heart when something is wrong. Anna states that she was so glad that healthcare professionals listened to her, yet also highlights that as a parent, it can be very hard to speak up. And Kylie very humbly states that parents aren't always right, but then neither are staff. And yet we all want the best outcome. Communication and dialogue are essential. We know that consistently involving families is complex, whether it be when that child is a neonate, whether they're a pre-verbal toddler, or whether they're an adolescent, and whether the environment be a neonatal unit, intensive care unit, a GP surgery, A&E, a busy children's ward, or even at home. It's also worth reflecting that there are some particularly vulnerable groups, those of Black and minority ethnic background, those whose language isn't English, or those who have a learning disability. Awareness of these vulnerabilities can increase our ability to respond effectively. If you were to seek feedback from the families that you serve, what would they say about your service? Do you inform them about their child's situation, consult with them, involve them, collaborate with them, or empower them and negotiate care together? Open and honest feedback from parents about how we're performing as healthcare professionals can be incredibly helpful if we're brave enough to seek it. And this is what Cincinnati Children's Hospital have recently tested. They worked with families so that families could activate directly a medical response team. In the UK, we'd normally call it an outreach service. What they found was when they actually put information in the hands of the parents via posters and information from staff, families very infrequently activated an additional team, and when they did, it was usually for reasons that were spot on, but possibly also when there had been communication failures too. This is a piece of work that we did way back in 2006 with families, asking them to raise concerns if they were at all worried if staff hadn't washed their hands, if they were concerned about treatments or interventions, if they needed further information, and also that if they wanted an additional friend or family member there during consultations, they'd be very welcome. This poster and collaboration really helped to shift the culture to bring parents and professionals together on this agenda. Anna reminds us, however, that sometimes, in the face of doctors with their authority and the power imbalance, it can be very hard for parents to speak up. And Deanne reminds us parents aren't being difficult. They just want the best care. So how can professionals help? Nicola shares, please can professionals explain how parents can contribute to their child's care? We need to have these conversations. Emma talks about the leadership that was demonstrated by a consultant who engaged her in the conversation and considered her one of the experts in her daughter's care. It gave her the confidence to speak up about concerns. She also highlighted that being valued by staff helped to keep her sane at a very difficult time when her daughter was unwell. We also need to hear experiences of people when things don't go so well. There are many parents who want to work with the NHS to help improve things. This is Jo with baby Jasmine. They've gathered experiences of families that help us move our services forward together, and professionals agree. Amit is a consultant paediatrician. He states, parents are the best monitors a child can have. Trust them, ambulate them where possible. And Jerisha, a children's nurse, confirms this. Never underestimate the parents, she highlights. And Dr. Ron Daniels, Chief Executive of the UK Sepsis Trust, clearly states, parents know when their child is ill, arguably better than any paediatric early warning score. So, some challenges for us as we go forward. Have you got a local role model who champions parent voice and involvement? What ideas do staff and parents have in your local area to ensure that they're involved? How does your team visibly demonstrate its commitment to listening and involving parents? Could, even do, parents participate in safety huddles? And is parental input included in the situation, background, assessment and recommendation, or SBAR process? Is parent perspective considered in the early warning assessment? Are parents actively engaged in medicines administration? There's a brilliant website for parents called Medicines for Children. Are parents invited to participate in staff education programmes? And are they invited to help us learn when things go wrong? And what parent voice do you have within your governance infrastructure? Wendy's a mum and she's a nurse lecturer. She asks us to work with parents, not against them, and to hear what they say, but also to give them a little bit of time and space so that we hear what they don't say as well. And it's Margaret Wheatley that asks us to be brave enough to have a conversation that matters and to take the time to listen. We need to be courageous, but we also need to share power. The more we work with children, young people and families that we serve, giving them information, collaborating and negotiating, the better outcome we'll have working together. These are some references that I thought that you might be interested in. But I Told You She Was Ill is an article written by a paediatrician about the importance of actually listening to parents' voice when their child is unwell. Developing and evaluating the success of a family-activated medical emergency team gives you a bit more information about the work at Cincinnati Children's Hospital. And Communicating with Children in Hospital is a great blog that actually gives us some really helpful hints and tips about improving our communication styles as we work forward together. There's a conversation happening in social media between professionals and also between young people and families. If you follow me at Kath Evans 2, join in our discussion, share your ideas, your areas of best practice, and together we can make care safer for the children, young people and families that we serve. Thank you for listening.